Hi and welcome. I'm trying to learn medicine. Today, Atrial Flutter. And after we've done that, we're going to do Neckstretching. If you participate in the Neckstretching, then it's very own risk. And we're talking about illness and also internal anatomy and blood system. And this is no medical advice, we're just learning about it. Atrial Flutter. That is an uncommon disturbance of a normal heart rhythm in which heart muscle contractions are stimulated at a very fast regular rate. Only a proportion of stimulations cause contractions of a heart muscle. The ratio of stimulations to contractions may be 2 to 1 or every 3 or 4 to 1. Atrial flutter is linked with degenerative heart conditions and is consequently seen most frequently in older people. Okay, I think I know what it is. The heart is sending out to make a beating, a contraction, but it doesn't happen. It has to be started like a car, starting at 2, 3, 4 times. Symptoms. The onset of symptoms is sudden. That is interesting. Medical. Awareness of rapid heartbeat. Breathlessness, chest pain and exertion, angina pectoris. Okay, the onset is sudden. There can be a rapid heartbeat and breathlessness and angina, so pain in the chest. Duration. Though atrial flutter may occur in spells, it usually continues until treated. I don't know what spells are. Apart from their magic. So spells. They continue until treated, basically, the way say. Causes. Myocardial infarction. The death of part of the heart muscle. See coronary thrombosis. Okay, the cause of it can be a myocardial infarction, so heart attack. And also congenital abnormalities of the heart. But the onset is sudden and it's most frequently in older people. Okay. Ischemic heart disease in which the blood supply is restricted. Okay, there can be a ischemic heart disease when the blood supply is restricted, and also rheumatic fever, which is characterized by scarring and inflammation of the heart. Okay, it can happen through rheumatic fever, when the heart is inflamed and scarred. Through ischemic heart diseases, where there's not enough blood coming to the heart. It can come through genetic effects, congenital abnormalities, and also through coronary thrombosis or through a myocardial infarction, heart attack. Treatment in the home, remain at rest in bed or chair until seen by a doctor. So rest and call a doctor. When to consult a doctor? If you are aware of a disturbance in the heartbeat. So if you notice a disturbance, then call the doctor. If there is undue breathlessness or chest pain. Undue breathlessness, so I think I mean if you don't do sport and are out of breath. Or if there's chest pain. What the doctor might do, try to slow the heartbeat if it is too fast. The pressure on one of the 2 carotid arteries in the neck. As I was thinking about it, I once mentioned what they're called a head carotid in the study. I said in Jubilee, it must be somewhere else. There as well. Carotid arteries. I don't know exactly where you are, but I think where you also. Okay, the doctor might try to slow the heartbeat down by pressing on the carotid arteries in the neck. And that works. Just I wouldn't go so far to say fascinating, but interesting, it's not strong enough. There is a treatment method to press on the carotid arteries to slow down the heartbeat. Well, the circulation is just shortened. Maybe that's the reason. Arrange for an ECG, an electrocardiogram, to reveal the nature of the disturbance. So they're checking how the heart is beating also, to find out what it is. Send the patient to hospital for treatment by drugs or electric shock to the heart to convert the abnormal rhythm to normal. Okay, there is some drug treatment, and also can the heart be shocked electrically to make this abnormal beating again normal. Prevention. This depends on the disease causing the condition. See causes above. No, rheumatic or rheumatic fever didn't be had so far, so maybe that could be something maybe done. One moment. And then it can be coronary thrombosis, so maybe what we had here with emphysema, things like that. Another moment. And okay, outlook. When an attack has stopped, drugs may be given to prevent another attack. How could a drug do that? Long-term outlook will be related to the disease causing the condition. Okay, there are diseases when it's not that good. Now, that was the atrial flutter. Okay, what did we have? Atrial flutter, that was too often this inclination of the heartbeat, but it doesn't happen. But there's still a rapid heartbeat. Let's see it again. An uncommon disturbance of a normal heart rhythm in which heart muscle contractions are stimulated at a very fast, regular rate. Only proportion of stimulations cause contractions of a heart muscle. And atrial fibrillation, that was an irregular beating of a heart. The atrium is the chamber of the heart from which rhythmical contractions spread to the rest of the heart. In atrial fibrillation, the contractions lose their rhythm and the heart beats irregularly. How does that come about? Okay. Causes very often no underlying cause can be found. Congenital deformity of the hearts, physiotoxicosis, thyrotoxicosis. Okay. Atrial fibrillation, that is irregular, whatever. And atrial flutter, that is too often. Maybe we should find out what the word fibrillation means itself, because in a way flutter and fibrillation, I don't know the difference. Okay, flutter, but it's often it's flashing, but it's not really helpful if you're having no fibrillation. And fibrillation, that is fibrillation. It doesn't really work either. But it's like driving about whatever it's called, a road with a lot of bumps. Now, that was the medical part. If you were here for medicine, you can calculate it to the next part of medicine. We will do now the Neckstretching. If you participate in the Neckstretching, that is very risk. We're starting with the hydrotower. The legs shoulder wide apart, and we're breathing in. We're stretching with the fingertips as far away as we can. And breathe in and stretch high with the fingertips, and again down. And stretch is still to the outside. Breathe again in, again. Reach with the fingertips as far away as you can. Breathe in. Reach with the fingertips high up and again down, reach to the outside. Next exercise. Again, reach with the fingertips as far as you can with the fingertips. Reach high up and not just to the sides, but also back, reach far with the fingertips. Again down and another round. Reach as far as you can with the fingertips. Back and down. And it seems a bit ridiculous, but maybe it actually works. To the push again. Feet together, arms up, and now basically let flying. And we go on with the next exercise. The police officer, feet standing still together, breathing and lifting the arms up. And breathe out, open the arms to the side. Breathing in the arms up. And out, open the arms to the other side. Breathing the arms in the middle. And out and down. Now the legs are shoulders wide apart. Breathe in. Tall up, shoulders back. And out, turn the head over to one side. Breathe again in. And breathe out, bring the chin down to the clavicle. Breathe again in. And out, lift the gaze and turn the head over to the other side. Breathe again in. And out, bring the chin down to the clavicle. Breathe again in. Out, lift the gaze and turn the head over to the first side again. And breathe again in. And breathe halfway out. And then bring the head in one circle over to the other side. Breathe again in. And breathe halfway out. And then go in a circle movement over to the first side. And head back into the side. Now we're doing the cryptic morning. Keep the legs standing shoulders wide apart. Breathe in, lift the arms up. And breathe out, lean back. Draw the shoulder blades together, open the chest to the sky. Breathe again in the arms up. And breathe out again, the shoulder blades together, open the chest to the sky. Again in. Out the arms down. Now the feet standing together. Breathe in. And lift the arms up. And breathe out, lean back, verried in the wind. Again in. And breathe out, lean again back. Breathe in. And breathe out, lean to the side, the final wind. Breathe again in into the middle. And out over to the first side. Again into the middle. Let's try to make the screw and the drill interchange. Or cross the arms into 20 fingers, reach high, breathe in. And now breathe out, reach in front out of the back. Breathe in the arms up. Change the position of the arms. Intertwine again the fingers and breathe in and reach high. Screw and breathe out, reach in front out of the back, the drill. Again in and up the arms. And out and down the arms. And now we're doing the cashew. Feet are standing together, intertwine the fingers behind the back. Shoulders back, tall up, breathe in. And breathe out, bring the head over to one side. And the chin down to the clavicle. Now breathe in. And out and reach with hands down to the floor. Breathe again in, head up. Over to the first side. Breathe again in. Out, bring the chin down to the clavicle. Breathe again in. And out, reach with hands down to the floor. Breathe again in, the head up. Back up to the middle. And now the cashew. No, the head of the cashew. Now the stretch of Venus. Intertwine the fingers behind the back. And bring them over to one side. Now breathe in, turn up the shoulders a bit back. And breathe out, turn the head to the side where the hands are. Breathe again in. And out, pull the arm in, and the shoulder down. Chin out again. Again, in, lift the chin. And bring the head out to the first side. The hands out to one side. Head out to the side where the hands are. Chin down to the clavicle. And breathe in. And out, pull the arm in, shoulder down. Breathe again, lift the gaze, turn the head back into the middle. Next. Let's do it one actually. Bring the arm back and pull the elbow a bit down. Just keep now breathing and try to be taller up. Then again out. Now change the arms. Breathe again in. Out with the arms down. And now we're ending with the sky haga almost. Breathe in with the arms up. Breathe out on the arms wide to the sky. Breathe again in, down up. And out, lean again back. Breathe in, up again. And out and down. Last time. Again in the arms up. Out the arms down. We're doing a few eagle swings. Breathe in. And out. Again in. And out. And one more of eagle swings. Out and down. And we're ending with a cactus collecting its stings. And weaving. Breathe in with the arms up. Bring the hands to touch and bring the heads down to heart set. That was the next stretching. I thank you very much and until next time.